Governor, Florida's leading the state right now, or one of the states leading with COVID-19 cases. The majority are unvaccinated. So how are you and health officials, state health officials, encouraging people to go get vaccinated?
Well, I think it's important. Your question raised an important point in terms of what we've seen in the last really couple months. Obviously, in July, which I told people months ago, we would see higher prevalence because it's a seasonal virus, and this is the seasonal pattern that it follows in the Sun Belt states, particularly in Florida. If you are vaccinated, though, the number of people that end up hospitalized after is almost zero. It's incredibly low. So I think there's some misinformation out there where someone will say, oh, these people were vaccinated and they tested positive. Understand, a positive test is not a clinical diagnosis of illness. And so if you're vaccinated and you test positive but you don't get sick, well, the name of the game is to keep people out of the hospital. And I think that the folks that have done that, and we're proud of our Seniors First strategy, we've done about 85% of our seniors in Florida have gotten shots. I think the data is increasingly clear that if you have been vaccinated or if you've recovered from COVID, because you are immune in that respect too, the chance of you being hospitalized or dying is very low. And so I think you're seeing that in other parts of the world and other parts of the country too, where you see positive tests going up. But like in the United Kingdom, for example, they have huge increase in positive tests, but their hospital census and mortality is not following suit. I mean, it may go up a little, but it is not surging like it would have over a year ago. And so I think that we have 3 vaccines available. Any adult can get it at pharmacies, health departments, you name it. Very easy to get, very quick process, and that's available. We also, if somebody ends up hospitalized, we have much better treatments, such as some of the drips that you can do compared to where we were last summer. Last summer, the number one thing we were sending was this remdesivir. I mean, honestly, I don't think remdesivir ended up being helpful. At least there's not a lot of data to support it. I do think the data for somebody that gets infected, particularly if you're in a high-risk group, for getting one of these monoclonal antibodies, I think the data has been very positive on that. And so obviously the best way is to get the protection beforehand. But if you do find yourself infected, please consult your doctor, especially if you're in a higher risk age group, because there are much more effective ways to mitigate the impact. And I just close by saying, as I said this a couple months ago, these things have a pattern. We saw the pattern last summer. It's similar. I think it started a little later. And so people should just be prepared for that. And as we get into the next month, the August and stuff, I think you'll start to see it go in a different direction. But that's just the way this thing is done. It's had a pretty consistent life cycle. And there's certain parts of the country that have certain seasonal, and so this is it. But the folks that are out there, 75% of Floridians over the age of 50 have gotten shots, and so we think that that's really positive. But I also think that we have to be careful in terms of some of the messaging for folks that may be skeptical about the vaccine. I do not agree with some of these people, some of these quote-unquote experts who lambaste people and criticize them or say they're stupid or something. That's not the way to reach folks, okay? So that's one of the reasons why I always said no mandates, because I think, honestly, I don't believe in mandates, but I don't even think it would be productive to do that. And so the folks who wanted it, the seniors, we worked hard to get it. Everyone who's wanted it obviously can get it. Now you're in a situation where you have folks who may be skeptical of it. And so understand, if you're communicating, you don't want to say things that are going to cause them to retreat even further. And I'm sorry, there's been a lot of misinformation and a lot of bad advice that's been given by some of these experts over the last year. These people saw all that. They remember all this stuff. So I'd say just, have a little humility when you're trying to carry that message. Understand that there's some people that may have qualms. And what I try to do is just present the data. And if I thought the data didn't justify, then I would say that, and I would be completely honest. But I think us going in doing Seniors First like we did, I absolutely believe that saved lives. I think it saved thousands of lives. Had we not done that, there would have been more seniors exposed, and even some of the seniors that did get infected, I think their illness would have been much more severe than it was because they had that protection. So I think the benefits have been clear, in the state of Florida for those who have done it.